Welcome to Health First Colorado's provider-specific training on non-emergent medical transportation, or NEMT. Today's training will cover a variety of topics important to non-emergent medical transportation providers. I will go over the following topics in order, and you will find the sections color-coded with this overview slide. First, I will give an overview of the non-emergent medical transportation benefit. Then I will discuss provider enrollment and revalidation, including credentialing requirements. I will follow that with information on member eligibility, covered services, and prior authorizations. Then I will discuss billing and payment processing specific to non-emergent medical transportation, including a demonstration of how to submit a claim on the provider web portal. There are three distinct transportation benefit programs through Health First Colorado. Members access non-emergent medical transportation, or NEMT, in order to get to and from medically necessary services, such as routine doctor's appointments and the pharmacy. Non-emergent medical transportation is different from emergency medical transportation, or EMT. Emergency medical transportation specifically provides transportation for members experiencing emergencies and needing to get to the nearest hospital or other facility for immediate medical treatment in order to avoid permanent injury or loss of life. Non-emergent medical transportation is also different from non-medical transportation, or NMT. Non-medical transportation provides services only to Health First Colorado members with a specific benefit plan under the home and community-based waivers programs. Non-medical transportation is not open to all members. As stated in the previous slide, non-emergent medical transportation is provided to members who need transportation to and from medically necessary but not emergency services. These members have no other means of transportation, including free transportation. Non-emergent medical transportation must be provided by a provider who is actively enrolled with Health First Colorado. Non-emergent medical transportation providers may provide urgent non-emergent medical transportation in some cases, and we will review this in more detail later in the presentation. A provider who renders urgent non-emergent medical transportation should be aware of differences between this and other non-emergent medical transportation services. They should also note the differences between this service and emergency medical transportation services. The transportation billing manuals are an excellent resource for this. There are several modes of transportation available within the non-emergent medical transportation benefit, including those listed on this slide. We will review ancillary or additional services that may be covered later in the presentation. Ground ambulance. This is for transporting members requiring cardiac or hemodynamic monitoring if the monitoring is required before and after transport. It also provides advanced airway management, which includes members who are ventilator dependent, requiring intubation and/or deep suctioning en route, or are on an apnea monitor before, during, and after transport. Fixed wing or rotor wing aircraft ambulance. This is for non-emergent pre-planned services that must be prior authorized, and they are due to great distances, member illness or injury that prohibit other forms of transportation, or obstacles that prohibit the transporting the member by land. The member's medical professional must indicate in writing that air ambulance services are required. For commercial airlines, in-state and out-of-state travel must have prior approval from the department, and the member's medical professional must indicate in writing that commercial air travel is required. mobility and ambulatory vehicles. These are designed, constructed, modified, or equipped to meet the needs of passengers with medical, physical, or mobility impairments, and providers must maintain a contract carrier permit or a luxury limousine permit. Personal vehicle mileage reimbursement. These services may be provided by a volunteer with no member vested interest or an individual with a member vested interest. Reimbursement is per vehicle without regard to the number of members or escorts in the vehicle. Public or mass transportation, including fixed route, light rail, paratransit, and private bus. Taxi cabs. Providers must maintain a common carrier certificate. These are not considered mobility vehicles, but providers may maintain a Medicaid client transport or MCT permit or luxury limousine permit. Train. In-state and out-of-state travel by train must have prior approval from the department, and the member's medical professional must indicate in writing that train transportation is required. Stretcher vans transport members not requiring medical attention en route, but must have the ability to be prone or lying face down or supine, lying face up, position on a stretcher, board, gurney, or other appropriate device. The member's medical professional must indicate in writing that transportation in the prone or supine position is required. Wheelchair van. The member's medical professional must indicate in writing that the member is confined to a wheelchair and unable to use less costly modes of transportation, and providers must maintain a common carrier permit. Let's talk now about provider enrollment and revalidation, as these are prerequisites for billing Health First Colorado. Before we get started, please note that there is a moratorium in place on new non-emergent medical transportation provider enrollments until April 1st, 2025. All transportation services must be rendered by a Health First Colorado enrolled transportation provider. Non-emergent medical transportation providers must be enrolled as provider type 73 and one of the specialty codes listed on this slide. Specialty code 326 is for providers within the state designated entity's service area, which includes the 9 metropolitan counties: Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, Jefferson, Larimer, and Weld. Specialty code 525 is for providers outside of the state designated entity's service area, otherwise known as the 55 other counties in Colorado. All transportation services must be credentialed by the state designated entity, TransDev Health Solutions, which is formerly known as IntelliRide. All drivers and vehicles must be credentialed by TransDev prior to enrollment and revalidation with Health First Colorado. The Centers for Medicare and Medicaid Services created a policy requiring all providers to revalidate or renew their enrollment in order to maintain billing privileges. Any driver or vehicle that either fails credentialing or is not listed as approved on the provider's credential roster is prohibited from being used to provide services to members. TransDev will review and provide a credentialing certificate once all steps are completed, and these certificates must be submitted with the provider's Health First Colorado enrollment and revalidation applications. All new drivers and vehicles added to the business at any time must be approved before they can be used to transport members. The steps for credentialing include: number 1, complete the credentialing request form that is linked here and the license agreement. Step 2, receive the email that includes the username, password, and link to sign up for credentialing software training. Step 3, participate in software training session to learn how to use the software. Step 4, visit platform.procredx.com to upload the required driver and vehicle credentials. And step 5, visit the TransDev Health Solutions website to sign up for a required vehicle inspection. Once the credentialing certificate is received from TransDev, providers should complete the enrollment or revalidation application. As noted on a previous slide, non-emergent medical transportation providers must enroll as provider type 73 and one of the specialty codes listed on this slide. Again, specialty code 326 is for providers within the state designated entities service area. This is TransDev's service area of the 9 counties listed within the metropolitan area. Specialty code 525 is for providers outside the service area. Non-emergent medical transportation providers use the atypical enrollment type and do not need a national provider identifier. Fingerprinting, site survey, and state approval are all required for all non-emergent medical transportation providers. All enrollment applications are reviewed by the department's fiscal agent, Gainwell Technologies. As fiscal agent, Gainwell Technologies enrolls providers so that providers can bill for services rendered to Health First Colorado members. Some, but not all, non-emergent medical transportation claims are submitted to Gainwell Technologies, and more information will be provided in this presentation. Please note that providers enrolled as provider type 73 cannot render services through another provider type or specialty code. For example, if a non-emergent medical transportation provider wishes to render non-medical transportation services, a separate enrollment application for provider type 36 is necessary to submit claims for the non-medical transportation services. The provider cannot bill non-medical transportation services through their non-emergent medical transportation provider ID. Lodging providers are not required to obtain Public Utility Commission or PUC or ambulance licensure, but they must enroll as a Health First Colorado non-emergent medical transportation provider in order to submit claims for services. Additionally, transportation services can no longer be billed on institutional claims by hospitals. Hospitals providing transportation must also enroll as a transportation provider and bill using a professional claim form, also known as a CMS 1500. We will discuss claim submission in more detail later in the presentation. For provider licensure or proof of exemption from licensure requirements must be included in the provider enrollment application. To determine the appropriate licensure, different types of providers have different places to contact. For ground ambulances, they should contact the county commissioner's office for specific county ambulance licensing requirements and/or verification of a valid license. Air ambulances should contact the Colorado Department of Public Health and Environment. All other non-emergent medical transportation providers should contact the County Commissioner's Office or Gainwell Technologies. In addition to being the state designated entity, the department has contracted with TransDev Health Solutions to be its transportation broker within the 9 Colorado counties of Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, Jefferson, Larimer, and Weld. A broker is a vendor that contracts with Health First Colorado to manage non-emergent medical transportation for members in the designated area. TransDev is contracted to do the following: credential transportation providers, including vehicle inspections and driver background checks as required to join the network, conduct ongoing provider training for providers that are new to delivering non-emergent medical transportation services, schedule rides to Health First Colorado covered services for eligible members, process reimbursements for members who are eligible for personal mileage reimbursement, coordinate out-of-state transportation for members once approved, and field and resolve any issues from providers. To be clear, TransDev is responsible for processing non-emergent medical transportation claims for providers working within their service area. Therefore, these providers do not submit claims to the fiscal agent Gainwell Technologies. Instead, they submit claims directly to TransDev Health Solutions. Providers in the 55 counties outside of TransDev's service area must be credentialed by TransDev, but they will not use the transportation broker to schedule or manage services. Members can contact providers directly to schedule their trips. And please note that TransDev does not transfer trip requests for members outside the service area. One other important note is that these providers will submit claims directly to the fiscal agent Gainwell Technologies. Now let's discuss members who are eligible for non-emergent medical transportation. First of all, you must verify member eligibility. Confirmation of eligibility is critical to a non-emergent medical transportation provider's ability to receive reimbursement for services rendered. Member eligibility varies depending on the type of transportation service being rendered, as well as the member's Health First Colorado coverage. More details will be given on eligibility criteria in the following slides. Also, eligibility verification steps differ depending on the county where service is rendered. For providers within TransDev's service area, must contact TransDev directly. For providers in the 55 counties outside of TransDev's service area, must verify member and medical professional eligibility themselves. They must verify and retain documentation of medical necessity for level of service authorization for trip requests, and they must submit claims to Gainwell Technologies. As a reminder, member eligibility can be confirmed in the provider web portal. Eligibility verification must be confirmed on the day of service, as eligibility can change. Eligibility cannot be verified for future dates. A successful verification of a member's eligibility alone does not always indicate that a provider will be able to provide services and receive reimbursement. Some, but not all, transportation services require prior authorization requests. More detail about prior authorization will come after the covered services section of this training. In the screenshot on this slide, you can see that this member is eligible for Health First Colorado covered benefits because Medicaid state plan is listed, and if the date of service is between the effective date and the end date, then this member is okay for non-emergent medical transportation services. For members under the age of 21, all transportation services provided to children under 21 years of age and their guardians or caregivers are provided with no cost sharing or copay and includes approved, non-covered, but medically necessary services. Based on early periodic screening, diagnostic, and treatment guidelines, medical necessity includes a service that will or is reasonably expected to assist the client to achieve or maintain maximum functional capacity in performing one or more daily living activities. EPSDT guidelines, the early periodic screening, diagnostic, and treatment guidelines, is not primarily for the convenience of the child, caretaker, or medical professional. It is not considered medically necessary if it is experimental or investigational and is generally needs to be accepted by the medical community for the purpose stated. And medical necessity includes a service that is the least costly of all alternatives while still being the most appropriate option for the child's physical or emotional condition. If the participation of a parent, family member, or other caregiver is necessary for a child's care, and such caregiver cannot access the child to participate in the care, then non-emergent medical transportation services may be covered for transportation of the parent, family member, or other caregiver without the member being present. Examples of situations where this might apply includes, but is not limited to, a child receiving inpatient care, such as in a neonatal intensive care unit, a child in a psychiatric residential treatment facility, or a child requiring the presence of a caregiver for breast milk provision, breastfeeding, family therapy, medical decision-making, or consent for surgery. Other passengers. A member's children and/or siblings, or the child or children of a member's escort, may use non-emergent medical transportation services in the following circumstances. If the member does not have access to childcare for the duration of the trip to and from the medical service. If the escort does not have access to childcare for the member's siblings for the duration of the trip to and from the member's medical services, or if the escort does not have access to childcare for their own child or children for the duration of the trip to and from the member's medical services. An at-risk adult, an individual 18 years of age or older, for whom the member or escort is responsible, may use non-emergent medical transportation services in the following circumstances. If the at-risk adult is unable to perform or obtain services necessary for health, safety, and welfare and susceptible to mistreatment, or if the at-risk adult lacks sufficient understanding or capacity to make or communicate responsible decisions concerning their person or affairs. Individuals are not considered at risk solely because of age or disability. Please note that the names of all additional passengers must be included in the standard trip log report. Most members have regular Health First Colorado benefits, also known as Medicaid or Title 19 benefits, since the Medicaid program was authorized by Title 19 of the Social Security Act. However, there are other eligibility types. Providers should note that members of the programs listed on this slide are not eligible for non-emergent medical transportation, including Child Health Plan Plus, Emergency Medicaid Services, Old Age Pension State Medical Program, Medicare Qualifying Individual, Qualified Medicare Beneficiary Only, or Special Low-Income Medicare Beneficiary Only. Let's talk about covered services. Medically necessary services include transportation after discharge from a hospital, transportation to and from medical or behavioral appointments, trips to enrolled pharmacies for vaccines, immunizations, preventive services, prescription pickups, and durable medical equipment. As mentioned before, a provider who renders urgent non-emergent medical transportation should be aware of the differences between urgent and other non-emergent medical transportation services. They should also note the differences between urgent services and emergency medical transportation services. Urgent non-emergent medical transportation is transportation needed to receive medically necessary services when a member is unable to provide advanced notice. In other words, an urgent service doesn't qualify as planned and is unable to be scheduled ahead of time through TransDev or the non-emergent medical transportation provider if outside of TransDev's service area. However, these services still must be administered through an intermediary who schedules the service at the last minute. This intermediary can be a medical facility. Some reasons for urgent non-emergent medical transportation to be rendered at the last minute include transportation after discharge from a hospital, transportation to and from critical unplanned medical appointments, or failure of a non-emergent medical transportation provider to pick up a member from an appointment within 1 hour of the scheduled pickup time. Note that none of these cases constitute a medical emergency or require emergency medical transportation. Urgent non-emergent medical transportation will still be provided only to and from services that are covered under Health First Colorado and meet the requirements for non-emergent medical transportation services. All medical or behavioral services must be provided in Colorado unless the service is not available in state. Out-of-state trips may be made as an exception at the department's discretion. They must be prior authorized, and TransDev, not the provider, must submit a completed NEMT air, train, and out-of-state request form to the department. For children who are at least 13 years old but younger than 18 years old may travel alone with a written release from a parent or guardian that confirms an adult will be present to receive the child at the destination and return location. Children under 13 years old cannot travel without an escort. Children in a day treatment program may travel without an escort with a written release from a parent or guardian that confirms an adult will be present to receive the child at the destination and return location. This is the only exception. Children are not eligible for NEMT travel to and from school-funded day treatment programs unless it is for specialized transportation to medically necessary school-based services specified in the child's individual education plan, or IEP. An escort may accompany a member when a member is a child under the age of 13 or an at-risk adult who is unable to make personal or medical determinations or provide necessary self-care. The member's Health First Colorado enrolled medical professional must indicate in writing that a travel escort is required. The escort must be physically and cognitively capable of providing needed services for the member. Transportation round trip can be provided for a member's escort if the member will not be accompanying the escort for the complete round trip. For example, if the member is being placed in the facility or residential treatment. Health First Colorado may cover the cost of transporting a second escort with written certification for medical necessity from the member's Health First Colorado enrolled medical professional if the member has a behavioral or medical condition which may cause the member to be a threat to self or others if only one escort is provided, or if the member's primary caretaker has a disability that precludes the caregiver from providing all of the member's needs during transport or extended stay. Meals and lodging, limited to 1 unit per day each per member or escort, are available for members when travel for in-state treatment cannot be completed in 1 calendar day. For members when travel for authorized out-of-state treatment does not include meals or lodging as part of the inpatient stay. And for escorts when a member is a child or an at-risk adult who requires the escort's continued stay. Reimbursement will only be made for meals and lodging that members and escorts are actually charged up to the daily per diem rate established by the department. Meals and lodging will not be reimbursed if the member is not normally billed. Again, lodging providers are not required to obtain Public Utility Commission or ambulance licensure, but they must enroll as a Health First Colorado non-emergent medical transportation provider in order to submit claims for services. For trips greater than 25 miles, Providers are reminded that they must transport a member to the closest available qualified provider. The closest provider is defined as a provider within a 25-mile radius of the member's residence, or the nearest provider if one is not practicing within 25 miles of the member's residence. Exceptions are allowed based on the following. The closest provider is not willing to accept the member. If the member has complex medical conditions that restrict the closest provider from accepting the member, or if the member has moved within the 3 months preceding transport and has not yet established treatment with a provider in the new locale. Member and medical professional must use these 3 months to transfer care to another closest provider as defined in Section 8.014.4.b, or determine transportation options other than non-emergent medical transportation. Any claim billed for procedure codes A0425 or S0209 will be suspended for review if the billed units of service exceed 52. Suspended claims will deny if there is no attachment that contains the following information about the trip being billed. These include the driver's name, the member's name and Health First Colorado ID, confirmation the driver verified the member's identity, pickup and destination addresses, date and time of the trip, including actual pickup and drop-off times, confirmation by the member, escort, or medical facility that the trip occurred, the vehicle identification number or VIN, or license plate number of the vehicle in which the trip was provided, and rationale and certification from the member's medical professional as to why the member cannot be treated by the closest provider within 25 miles of the member's residence. This is for trips prior to May 1st, 2024. Effective May 1st, 2024, the member's medical professional, either rendering or referring, must complete the verification form for transportation services more than 25 miles to verify medical necessity of trips that exceed 25 miles one way. Other appropriate employees, such as clinical or administrative staff, may be designated to sign the form. Provider signature is not required prior to the trip, and the form must be submitted with claims submitted through the provider web portal. The form is valid for 90 days for recurring medical appointments, such as dialysis or cancer treatments. It is the driver's or provider's responsibility to get the form signed by the member's medical professional, not the member's. Drivers cannot require members to obtain signatures on this form. Information required on the verification form for transportation services more than 25 miles includes the member information, which is first and last name, date of birth, and Health First Colorado member ID, provider information, including the name and address of the medical facility that the member is being transported to and from, the medical facility contact name, title, and phone number, the medical professional's name, title, and Health First Colorado provider ID. The verification dates. These are the dates verification is valid for, which are determined by the member's medical professional, and the dates of trips, which are the dates on which services are actually rendered. The reason the member cannot be seen by a medical provider who is less than 25 miles away, the printed name, signature, and ID of the medical facility staff, and the date of signature. As a reminder, providers enrolled as provider type 73 cannot render services through another provider type, such as emergency medical transportation, which is provider type 13, and non-medical transportation, which is provider type 36. The following services then are not covered by non-emergent medical transportation: emergency medical transportation services, non-medical transportation services, Remember that non-medical transportation is available only to members on home and community-based services waiver programs. Also not covered are services provided only as a convenience to the member, transportation to and from non-covered medical services and providers, including services that do not qualify due to coverage limitations, charges incurred while the member is not in the vehicle except for lodging and meals, charges for additional passengers except when acting as an escort for a child or at-risk adult, wait time, and cancellations. When transporting more than one member in the same vehicle to the same location, this is not covered. Only one Health First Colorado member ID may be used for billing. Multiple claims for the same vehicle's trip mileage also will not be reimbursed. Other services not covered are transportation for nursing facility or group home residents to medical or rehabilitative services required in the facility's program, unless the facility does not have an available vehicle. Nursing facilities and group homes should report transportation as part of their allowable costs on their state-approved cost report. Other services not covered include transportation which is covered by another entity, such as transportation provided by a school or the Veterans Administration. Transportation provided by metered taxi services is not covered. Transportation provided by ride-sharing companies such as Lyft and Uber are not covered. And response calls when upon arrival at the site, no transportation is needed or provided is not covered. Now let's talk about prior authorizations. Prior authorization is not required for most non-emergent medical transportation services. However, the department does need to authorize train, air, and out-of-state travel prior to delivering the service. Members and/or their medical professionals requesting train, air, or out-of-state travel must contact TransDev Health Solutions, and TransDev will complete the appropriate request form to submit to the department. The department will review the documentation, make a decision, and communicate the decision to TransDev. For billing and payment, we're going to discuss some information specific to non-emergent medical transportation providers. If you have not attended a beginner billing for professional claims training, I encourage you to do so, as it goes over topics like payment processing schedules, claim submission, how to read remittance advice reports, and timely filing guidelines in much more detail than this presentation. Providers must maintain legible, complete, and accurate records necessary to establish that conditions of payment for Health First Colorado covered services have been met, and to fully disclose the basis for the type, frequency, extent, duration, and delivery of services provided to members. Records shall be created at the time the goods or services are provided. Records should include, but are not limited to, the following: billing, prior authorization requests, all service reports and orders prescribing services, and records of all payments received from Health First Colorado. On the right is an image of the paper CMS 1500 claim form that can be purchased at most office supply stores or online vendors. Many software companies use this template for batch billing, so it is helpful to be familiar with it. I am now going to open the non-emergent medical transportation billing manual to show the required conditional and optional fields for the claim. I am now on the main webpage for the Colorado Department of Healthcare Policy and Financing. If you go to For Our Providers, you will find a wealth of resources here that I go over in much more detail during the beginner billing training. Where I'm going to go to get to the billing manual is clicking on Provider Services and then going to Billing Manuals. I am going to come down to the CMS 1500 Professional drop-down menu and scroll down to Transportation. Here you will find the non-emergent medical transportation billing manual. I will open that up and scroll down. It will give you, the billing manual is a great resource. It will give you information on the covered services, member eligibility, more information about the urgent, non-emergent medical transportation benefits. It will give you information on procedure coding for your claims. It will give you information on diagnosis codes and other billing information. And down here is a CMS paper claim reference table. So if I click on that, it is going to take me directly to it. And this is where I can look and see what the different field labels are and whether they are required or not. So here you can see insurance type is a required field. The insured's name is conditional, and over here it gives more information about this. So this is for specifically for a Medicare health insurance policy. So you would complete this field if the member is covered by a Medicare health insurance policy. The patient's address, you can see, is not a required field. So as you go through here, you will see the different fields that are required on the claim for particular members. If I scroll down, there is also a transportation claim example. And so this will also give you a resource to follow as you are completing your claims. Now I'm going to go back to our presentation and talk a little bit more about billing and payment for NEMT. The professional claim form requires a billing and rendering provider to be listed. For non-emergent medical transportation, these fields should include the same Health First Colorado provider ID. As a reminder, transportation services can no longer be billed on an institutional claim by hospitals. Hospitals providing transportation must also enroll as transportation providers and bill using this professional claim form. Also, providers within TransDev's service area submit claims to TransDev, while providers outside of the service area submit claims directly to Gainwell Technologies. Providers submitting claims to Gainwell Technologies are encouraged to submit them through the free provider web portal. Effective October 1st, 2024, all non-emergent medical transportation providers must use the department-provided standard trip log for all rides provided. This is located on the non-emergent medical transportation webpage. Providers must complete online or on paper, submit this electronically with claims, and keep completed trip reports on file. The department may request copies of any and all trip reports for the provider's claims at any time. Information required on the standard trip log includes the member's information, including their first and last name, Health First Colorado member ID, signature and date of signature, and verification by the driver of the member's identity through the driver's license or Health First Colorado member ID card. Also required on the standard trip log is escort information if applicable, including the first and last name, the non-emergent medical transportation provider information, including the name and Health First Colorado provider ID, the driver information, including first and last name, vehicle information, including the type of vehicle and the license plate number or vehicle identification number. Also required on the standard trip log includes trip information, such as what type of trip it was, if it was one-way or round trip, the pickup time and odometer reading, the drop-off time and odometer reading, total mileage, the pickup address, the drop-off address. Also required is certification, which includes the medical facility representative name, title, and signature. The member ID must be used on all claims. If the person being transported is not enrolled with Health First Colorado, the member ID of the child or at-risk adult for whom the transportation is scheduled should be used on the claim. Documentation must substantiate the medical necessity of the service and reason for the escort. And documentation must include signature of the member's medical professional who is ordering the participation of the parent, family member, or caregiver. Each detail line includes space to enter two dates of service, a from date of service and a to date of service. Both dates must be completed. For services rendered on a single date, complete the from date of service and the to date of service with the same date. Please note that span billing is not allowed. Use place of service codes, either 41 for land transportation or 42 for air transportation. Transportation certification is optional for non-emergency medical transportation claims. The diagnosis code R68.89 is required on all claims. Do not fill unused spaces with zeros. The diagnosis must be referenced on each detail line by placing a 1 in the diagnosis indicator field. Each detail line on a claim must include a valid procedure code. Health First Colorado uses the Centers for Medicare and Medicaid Services Healthcare Common Procedural Coding System, or HCPCS. HCPCS are used to identify and reimburse non-emergent medical transportation services. Procedure codes are available in the non-emergent medical transportation billing manual. The department updates these HCPCS codes regularly. Any changes to the billing manual are communicated through provider newsletters and monthly bulletins. Enter N or leave blank the emergency indicator to indicate the service was non-emergent medical transportation. There is no limit to the number of daily trips a member can receive from one or multiple providers. When billing for one member taking multiple trips in the same day with the same rendering provider, modifier 76 must be used. When billing for one member taking multiple trips in the same day with different rendering providers, modifier 77 must be used. The exception to this is that effective October 1st, 2024, procedure code A0434 for specialty care transport base rate for ground ambulances has been set to a limit of 4 units per day per member, which equates to a maximum of 2 round trips. Mileage is paid for the shortest trip length in miles as determined by an internet-based map, trip planner, or other global positioning system or GPS. Exceptions can be made by Transdev if the shortest distance is impassable due to severe weather, road closure, or other unforeseen circumstances outside of the member's control that severely limits the use of the shortest route. Payment will only be made for the least expensive mode suitable to the member's condition. Claims that require manual pricing must include an attachment that supports the claim. Billing members for covered services is strictly prohibited regardless of whether Health First Colorado has reimbursed the provider. If reimbursement is made, providers must accept this payment as payment in full. Balance billing is prohibited. The next section will cover some important resources. We have several resources listed here for non-emergent medical transportation providers, including the non-emergent medical transportation webpage on the department's website. Also listed here are some relevant billing manuals, including the General Provider Information Manual, which is an overview of the Health First Colorado program. There are several quick guides located on the department website that are helpful when submitting claims through the provider web portal. Also included on this slide is the Find a Doctor tool for members and providers to locate the closest qualified provider of a service. There are links to contacts listed on this slide. Providers with questions for the fiscal agent are encouraged to reach out to the Provider Services Call Center. Finally, this slide includes the many regulations that guide Health First Colorado's management of the non-emergent medical transportation benefit. That is all that I have for you today. On behalf of Health First Colorado, we do want to thank you for attending this training and for rendering services for Health First Colorado.